shoulder elbow joint mobilization. I'm going to start with the distraction of the ulna, the trochlear head, which is okay. All right. What we're going to do is I'm going to try to do the distraction first, so we can remember that we have a painful elbow joint. So we're going to start with approaching our treatment to reduce the pain. So I prefer to do the distraction first. I'm going to do this scooping mobilization of the humeral-ulnar joint. In our case scenario, the patient only have like 15 degrees motion, which is up to the 90-degree point. So it's approximately right here. Okay? I will be in a seated position as a therapist, and I will have the patient's arm resting on my shoulder. Just try to relax. Okay? So my right hand will be on the joint line of the elbow. Okay? This is together with my cupping with the left hand. And I will do a little bit of distraction and scoop mobilization right there. You feel that? Okay. Now there is also something going on the glenohumeral joint. So if you have an assistant, you may want to ask the assistant to stabilize the glenohumeral joint. Okay. Again, I'm going to do it again. Right there. Okay. Okay. There we go. All right. Now that's for the humeral-ulnar joint. Okay. Now for the we're going to move on now to the elbow extension. Okay. Now in the elbow extension, I prefer to be in standing position. Trying to examine the subject's elbow here, which is a very stable elbow. Okay, all right. Now in the extension, since the patient had like 7/810 pain and then only had 15 degrees, so we started with the reducing the pain. And secondly, what we can do is to basically do an extension. Okay. This is the movement like this. Only in a small amplitude at the beginning of the range. My left hand is basically supporting the elbow like this. Okay. I'm going to keep on adjusting my position so it'll be more comfortable for me to do this mobilization. All right. Okay, and the second grade is larger amplitude, only at the available range. Okay, now as we progress, let's say the patient pain is reduced, and we're going to work more on the stiffness. So we're going to move on to the grade 3 and 4 of the elbow joint mobilization. So one thing that you could do is to position your hand. I prefer to do this, okay, this way. And my basically my elbow, my forearm would be stabilize the glenohumeral joint there. And we'll do it this way. Okay. There's the joint line. So I'm cupping the elbow like this. Okay. Grade 3. Alright, and then I will position the patient's forearm closer to my body here, to my thigh, for grade 4, so a small amplitude, up to the resistance. Okay, so grade 3, this, larger amplitude, okay, and then grade 4, closer to the body, copying that. Small amplitude. is for the extension. Okay, now for the flexion, again the patient is in this supine position, and what we're going to do with the flexion is and my left hand will be on the patient elbow anteriorly, and my right hand will be doing the motion. Okay, a little bit there. I'm doing a little bit of okay. Now start again with small amplitude, first grade, and then grade 2, larger amplitude. Okay, and then grade 3. As you can see, I'm just maintaining my position right here because I prefer to do it this way. So larger amplitude. Okay, and grade 4, add to the resistance, small amplitude. All right. Okay, so we did the elbow flexion and extension. Now for the elbow pronation and supination, now we are all aware now that the pronation supination happens on the humeroradial head. So we're gonna, palpate the radial head, which is right here. Okay. So let's start to work with the supination. Alright. So with the supination, the therapist's hand will be holding the patient's wrist with my index finger right there in between the thenar and hypothenar compartment of the patient's hand. And my fingers is basically spread out to the distal radioulnar joint. My thumb is right there at the radioulnar joint. Okay, and my thumb right here is basically on the radial head. Okay, so for the supination, I'm basically applying the gliding motion while supinating the patient's forearm. Okay, so I'm doing this simultaneously. As I supinate, I push the radial head that way, going this way. Okay, so that's the supination. All right, so you start from grade 1, grade 4. Okay, now for the pronation, I prefer to do it on the other way. Okay. All right. The position of the arm is again the same as the supination, in a neutral position right here. Okay, mid-range supination, pronation. So this is now at the mid-range. So I'm going to position myself the same thing. Okay, but mostly my fingers is spread to the distal radioulnar joint here, and the rest are same as the thumb is under the dorsal aspect of the wrist. Okay, now as I pronate this, it's going this way. I'm applying a little bit of distraction on the radial head there, and then I pronate. Okay. Okay. All right. All right. Now we're gonna move our treatment on the patient's wrist. You can do it in different position, but I would prefer for my patient to be in a sitting position to address the wrist joint mobilization. Okay, I'll be back here. Yeah, sit right there. Okay. Okay. You can move right here. All right. Now at this moment we're going to perform the joint mobilization of the wrist. flexion, extension, radial, and ulnar deviation. Now, I prefer the patient again in the sitting position and just make him relax, try to relax there. Now I have a face towel here if it's needed. You can basically position it on the, there you go, resting position. The wrist is just hanging on the side of your table or your plinth, okay? Now for flexion, what we're going to do is to move your pressure is applied downwards to improve the flexion of the wrist, like this. Okay? So, first thing is I perform the distraction from the distal radioulnar joint and the carpal bones. So distraction right there. Okay? And this is a stiffness, so we're going to start with grade 3 and grade 4. And the applied force will be on the patient's, my right hand is doing all the motion. My left hand is just stabilizing the forearm. Okay? Alright. Now for extension, wrist extension, I prefer to do it like with the same position, but this time I applied more force on, upward force like this. Do 10 oscillations with 3, 4, more like the 2. Okay. All right. Now for our ulnar deviation, we position the patient forearm on the neutral position in between the supination and the pronation. Okay? So again, I prefer to do this like in patients in sitting position, and I'm also in sitting position. Now, if you want, you can do it like also in standing position. Okay? So let me just stand up so we can have more better view here. Okay. So again, I apply distraction on the distal radio ulnar joint. Okay? And apply a little bit of radial deviation, and then my oscillation. Okay, downwards to improve your ulnar deviation. Okay, now for the radial deviation, you just do the opposite. Again, do the distraction. Okay, and same position with my right hand and left hand, but this time you apply the glide upwards. Okay, now this is to improve our radial deviation. Okay, all right, that ends our demonstrations, and thank you very much.